very fortunate to be involved in the Impassion 130 study. This study was the first study to demonstrate the efficacy for immunotherapy for patients with metastatic triple-negative breast cancer. It showed that patients who were newly diagnosed with treatment-naive metastatic triple-negative breast cancer could be enrolled to receive the combination of the anti-PD-L1 antibody atezolizumab with the chemotherapy drug nab-paclitaxel. And patients who were specifically PD-L1 positive in their tumor benefited from this combination relative to those who received nab-paclitaxel with placebo, with regard to both progression-free survival, for which there was a 2.5-month improvement, and overall survival, for which there was a 7.5-month improvement. This is very exciting because it's the first success for immunotherapy in patients with breast cancer, and specifically for patients with advanced triple-negative breast cancer who've only been able to benefit from chemotherapy in the past. That really laid the groundwork for the neoadjuvant trial, KEYNOTE-522. This is a clinical trial that enrolled 1,174 women to receive neoadjuvant therapy with the PD-1 antibody pembrolizumab combined with standard neoadjuvant chemotherapy. This particular chemotherapy regimen included a taxane with carboplatin, followed by anthracycline-based chemotherapy in combination with either pembrolizumab or placebo. Patients then went to surgery, and those that received pembrolizumab in the neoadjuvant setting continued on pembrolizumab to complete a total of 1 year. Those who received placebo in the neoadjuvant setting continued on the placebo drug. The two primary endpoints for this study were the rate of pathologic complete response and the event-free survival benefit. Both endpoints were positive for this trial for the group of patients that received pembrolizumab. Very interestingly, there was no association of benefit with PD-L1 expression in these patients. So regardless of whether the tumor has PD-L1 expression or not, in the early disease setting, patients can potentially benefit from pembrolizumab. The other key part of this study is that it specifically enrolled patients with high-risk disease, so patients with stage 2 or 3 disease, patients with earlier stage disease that were not at quite such high risk for recurrence were not eligible. So this is now a standard of care for women with newly diagnosed early stage but high risk triple-negative breast cancer regardless of PD-L1 expression, another very exciting development for these women. What we would like to do now is refine this neoadjuvant regimen because it's a lot of therapy. There are probably patients who could get less therapy, and we need biomarkers to identify who those patients are. And there are patients who do not respond, so we need biomarkers to indicate what other therapies may be better therapies for those patients.